Hello and welcome to your favorite program on Clearview Television, You and Your Health. And I am your host, as usual, Rose Audu. And with me in the studio today is Dr. Chikaodinaka Ezeokeke. You're welcome to the program,
Thank
Doctor.
you so much. It's a pleasure.
And today we're going to be talking about hepatitis. You'll agree with me that this disease is eating deep into our society, and hence the need for us to talk about it and find a possible solution to kicking these out of our lives and out of our loved ones around us. And Doctor, please, what is hepatitis?
Okay, thank you so much for this opportunity. Hepatitis is actually called inflammation of the liver. So there are many things that actually cause that inflammation. It's beyond just infection. When we say inflammation, that means the cells are actually affected by one thing or the other, and they start going busy. So that's what you have as hepatitis. That's how to explain inflammation, basically. So hepatitis is mainly inflammation of the liver. Now, a lot of things can cause hepatitis. There are a lot, from viruses to drug toxicity to chemical injury to infection, a lot of bacterial infections or generalized infections of the body that can affect the liver. A lot of things can actually cause hepatitis. So I think stop at that.
Okay, that's beautiful. Well, can I say, or can anyone out there say hepatitis is hereditary? Can you get it from your parents? Like, is it genetic?
Okay, the only type of hepatitis that can actually be explained by hereditary terms is only autoimmune hepatitis. Here in autoimmune hepatitis, some factors which cannot be explained just cause inflammation to the liver. That's the only situation where we can have something that has to do with genetic or no genetic, or probably when a patient has polycystic liver disease, you have cysts in the livers, and before you know there's some inflammation and all. But basically, hepatitis, the most common causes of hepatitis are not hereditary. Yeah.
All right. Having said that, a lot of persons like me, we could be moving around in our society, in our community, not knowing you are already infected, like you already have a problem like hepatitis. Now, what are the common symptoms one should look out for?
Okay. For hepatitis symptom, one thing about hepatitis is that it only shows up symptoms when the degree of liver damage is actually more than 50%. Basically, it's a silent kind of disease and gives out symptoms when when a lot of the liver cells have been replaced by fibrous tissue, basically. So the common symptoms that people might present with in acute hepatitis might be just yellowing of the eyes, which everybody calls jaundice, and then subsequently you're seeing abdominal swelling where the patient's abdomen is distended, then we have leg swelling and all that. Patient might lose weight differentially. You see a lot of weight loss on the face, the arms, and then the leg and the abdomen is looking like enlarged. So you see differential weight loss and all that. Then you can also see signs as a result of complications of the liver disease when it has gone really, really bad. So liver diseases or hepatitis gives up symptoms mostly when the liver has actually gone so badly damaged. So you see a lot of people can walking about with hepatitis and not have symptoms, basically. So they might just have vague symptoms, maybe like fever, malaria, like flu-like symptoms. But when they start displaying symptoms, it shows that there's some degree of injury and something has to be done, to stop that inflammation from progressing. So that's basically it.
All right. So how is hepatitis diagnosed?
Now, diagnosis of hepatitis depends on the type. Now, if we want to, the most common causes of hepatitis, number one, the viral hepatitis, which everybody knows about, hepatitis B and hepatitis C, which is the most common. We have other hepatitis like hepatitis A and hepatitis D, but that is less commonly found because we don't really have regular diagnostic measures to actually diagnose. So it's always, and most of them are self-limiting illness. What I mean by self-limiting is that once it comes, it can go on its own. The body's immune system can suppress those viruses, but the most common ones that can overcome the body's immune system is hepatitis B and hepatitis C. So that's why you see common. Another cause of hepatitis is alcohol. Okay. Alcohol can cause what we call alcoholic liver disease, which will also present as hepatitis and all. We also have drug toxicity. There are some drugs that can actually cause inflammation to the liver, you know, and then we also have the autoimmune I talked about, where the body system destroys himself. So now, each one of them have their different method of diagnosis. The hepatitis B and C, which is pretty common, can be diagnosed by some immune reaction, you know, some basic simple tests. Diagnosis like the hepatitis B test and all that, where the antigen of the particular hepatitis is actually detected through those tests, or the presence of the antibody, as in hepatitis B and hepatitis C, antibodies to the infection. For alcoholic liver disease, there are some lab tests that can actually tell you that, oh, this person's liver disease or hepatitis as a result of alcohol. There's one we call gamma glutarate transferase. When we do that, can actually tell that, okay, if the level of gamma glutarate transferase is high, we can say this patient is having hepatitis as a result of alcohol. Then we also have other forms of, some of them can either be diagnosed on when you do the ultrasound scan. You see the inflammation or the fibrosis that has occurred already in fatty liver disease. You know, when somebody's obese, they can also have hepatitis. Obesity can cause hepatitis because of the deposition of fatty tissues around the liver. So there are a lot of, and every one of them have their ways by which they're diagnosed, basically. Okay.
So now, having talked elaborately about the types of hepatitis, how deadly are these hepatitis types?
Okay, majority of them can be actually controlled when found, when diagnosed. The problem with hepatitis is that once diagnosed early, it can be controlled. Inflammation can be stopped, can be controlled. But if it's diagnosed late, at the time when there's a lot of liver damage has occurred, then there will be little or nothing that can be done. You know, that's the issue. So the most common, which is hepatitis B and hepatitis C, like most of the patients that we have with hepatitis B and hepatitis C, by the time they're presenting to you, they're already having signs of chronic liver disease. That means they've had the disease for a very long time. The livers have, I'm always saying kidneys. The liver has almost been replaced by fibrous tissue. Some of them, the liver has transformed and turned into malignant cells, as in turned into cancer. So hepatitis B and hepatitis C can cause liver cancer. Wow. So when it transforms, it can cause liver cancer. So that's what we talk about deadly. Even the alcoholic liver disease, you know, it's at first is harmless, but by the time the person presents late, by that time there's already damage to the liver, there's portal hypertension, the person is vomiting blood, and all. At that time, there's little or nothing one can do. You understand? So the problem with hepatitis is the fact that it is not diagnosed early. Most patients that pass on are diagnosed late. That's the problem we have with hepatitis or any other form of liver disease that we have.
Now, let me take you back a little on the alcohol-triggered hepatitis. You know, you have a lot of persons who are addicted to alcoholic drinks, and some will even tell you they take it because of their health or something, or maybe to stay healthy, or to maybe from stomach problem or stuff like that. How do you convince such patients to stay off alcohol, you know, to prevent hepatitis?
The truth is, everybody knows the truth, and I believe everybody knows the truth. When you're taking something for your heart or for your tummy ache, you won't take too much of it. You understand? Now, alcohol is not bad when you take little of it, but when you take too much of it over time, it causes a lot of damage to you. So too much of it is the problem. It's not the taking of the alcohol, it's the taking of too much of it over a very long time. This is not, you cannot just drink alcohol for 1 month and start, you understand? It has to be over a very long time. And then you start seeing the effects on the liver and every other organs that it affects. It also affects the heart and a lot of other issues. So alcohol is not, taking of the alcohol is not the problem. How much do you take? And how long have you been taking? You understand? We have to get to a point where we know that we need to take it moderately. Maybe once in a while also, it's okay. When you overtake it, there's a problem.
All right. Would you want to talk about the major modes of, you know, transmission of hepatitis?
Okay. If you're talking about transmission, I believe you're talking mostly about the infective hepatitis, which is hepatitis B and hepatitis C. Now, for the mode of transmission of hepatitis B is through fluids. Now, once there's fluid contact, between one individual or the other, there's risk of transmission. Now, for example, if there's if a fluid from somebody who is strongly hepatitis B positive, hepatitis C positive, comes in contact with an open skin of somebody who is not, there's increased risk of transmission. The use of sharing of syringes or sharing of sharp objects is another way it can be transmitted. Another way that everybody knows popularly, sexually transmitted. And sexual transmission is like the most common means of transmission. Then another way is through, still talking about sharp objects, unsterilized hair cutting instruments, the barbing instruments. It's another way one can get it. Then it was noted that there was this community, one of my seniors talked about, that it was noted that they had this hepatitis. So they did a research to find out, and they found out that because they patronized these local people who do the nail cutting with unsterilized equipment, that's why most of them had hepatitis. So they are like, the most important thing is contact with body fluids, not just contact on the body.
Yeah, because I would really want you to
body fluid to blood, to an open skin.
Like sweat?
Yes, even sweat, even, you understand, to open skin.
Okay.
That's how it's transmitted.
Okay, what about saliva, like maybe kissing or something?
Kissing, the person receiving the kiss has to have a cracked mouth.
Okay, yes. But if there is no cracked mouth, then you are not at risk of...
No.
Okay, thank you.
So it's better not to put yourself in that kind of situation. You don't know if your mouth is cracked.
All right. Okay, we've talked about how deadly it can be.
Yeah.
Now, can you say hepatitis can be prevented?
Yes, highly.
How?
I believe all diseases can be prevented.
And how can?
And that's why I love preventive medicine more than anything. Now, I talk about the most common: hepatitis B, hepatitis C. We have that's infective hepatitis. We have alcoholic hepatitis. We have the fatty liver. We have a lot of, most of them can be prevented. For example, hepatitis B and C.
Okay.
If you get yourself vaccinated for hepatitis B early, that's a means of prevention. Even if you kiss 100 people with, you understand, the vaccination can last you up to 10 years. You understand? You're protected, you're immune. So vaccines can work for hepatitis B, though no vaccines for now for hepatitis C. So for hepatitis C, you avoid contact with, one who has hepatitis C. So when you're treating, or when you're working with, or relating with someone who has hepatitis C, you have to protect yourself, and all that. Then for the alcoholic liver disease, please don't take too much of alcohol. Reduce your alcoholic dose. Once they take in moderation. Too much of everything is usually bad. Then talk about obesity. Most patients with fatty liver as a cause of hepatitis, once they lose weight, you find that the liver sort of regenerates and repairs itself. So that's that. So majorly, about the only part of the only type of hepatitis that may not, because that one you can't control what causes it, is the autoimmune hepatitis. That one, the body just destroys itself. So the only thing that can stop the hepatitis from progressing to chronic stage is when the patient, when it is diagnosed early, and they give the patients medications that can slow down the immune process, and this will stop the trauma to the injury to the liver, and then that will be fine. So basically, most of the causes of hepatitis can be prevented in one way or the other. Okay,
at what point can you say maybe a patient is actually, maybe you've gotten to the autoimmune hepatitis where your body cannot actually
it doesn't just happen to anybody. Okay. You understand? You have risk factors for it. You understand? Autoimmune, it doesn't happen to just anybody. Either you have the presence of other autoimmune disease which later affects the liver, or anything, but it doesn't just happen to anybody. So it's not, it's very, very, the degree of, let's say the percentage of patients with hepatitis that are autoimmune, very, very slim.
Okay. Now, I haven't talked about that. Talking about, getting vaccinated, talking about the vaccine, how can a patient get, like a true, like, I don't know how to put it, but we have tendencies of people giving fake vaccines and all of that. How can one who have hepatitis, get the right vaccine and get cured or prevent it?
Okay, not for cure, it's
but
for prevention.
Prevention, sorry.
Now, The national program for immunization doesn't only covers children, vaccination of children with the hepatitis vaccine. You know, the children have that till I think about 6 months. So hepatitis vaccine. But for the adults, most of the my patients in the hospital, they get to buy their vaccines outside. They get to buy their vaccines from a reputable store. Not all stores have vaccines to sell. For you to have vaccines to sell, you must have a cold chain. Of course, nobody's going to sell a vaccines to you without you must have a cold where you store those vaccines so that they don't get attenuated easily or destroyed or anything. So for when you get the vaccine, just check if it expired or not. You understand? And make sure that it's a reputable store that is selling the vaccine to you. If you are in doubt, please go to the major big hospitals like the National Hospital of Gwagwalada. Hopefully, they have these vaccines readily and it can be accessed easily. You understand?
Now, in some cases, when you get to these clinics, like the nurses they've prepared it already to give you. You don't get to see the content, or I don't know.
No, if you ask, they can give you.
Okay.
They can give you the bottle. Say, please, can I see the bottle? Just ask nicely. They'll give you.
And how long are you supposed to take the vaccine?
The vaccine is for, you're supposed to take a start dose, then 1 month, 1 month after, then subsequently, I think you're supposed to have like 4 doses of the hepatitis B vaccine. That's for the hepatitis B vaccines. Okay. Then that's done for some time. You understand? 4 doses, basically. 4 doses.
None. Who can you say is at risk of contracting hepatitis?
Okay. The risks are the types of the hepatitis tells you the risk. Now, for the hepatitis B and C, which is most common, the people at risk are people who IV drug users. Before, we used to say IV drug users are Oyibo people thing. But right now, we have a lot of drug abuse happening in our society. So IV drug users are people at risk. The healthcare professionals, we that attend to the patient, we are at risk. A lot of things happen every day. You can be attending to a patient, a splash of fluid can go into your eyes. You know, anything can happen. Patient might struggle with you and you get pricked and all that. So the healthcare professionals, you know. 3, the sexual workers, they can be at risk, or anybody with promiscuous behavior, you know, having unprotected sexual intercourse, you can be at risk for hepatitis B or C. Now, another one is if you share sharp objects with other people, you put yourself at risk for hepatitis B or C. Sharing sharp objects. Then contact with, apart from the healthcare givers, when those who take care of the sick, like the relatives of the sick, sometimes before they get to the hospital, they may have been attending to their relative in the house. So this can actually, if they do it unprotected, they can actually come in contact with those fluids with an unbraided skin and all that, and get some part of the infection. That's why once we get to see patients with hepatitis B or C, and the patient has been intended to, we usually suggest to the relatives to go and do a test and get themselves vaccinated. Then another thing is through medical equipment, unsterilized medical equipment, or that we call that iatrogenic. Maybe in the course of treatment, maybe what they're using, but that's the risk of that. The risk of having hepatitis through those is very little, because right now, then through blood transfusion. Blood transfusion is another one. The risk is very little also too, because there's a lot of screening that the blood gets through to ensure that it is suitable for, it has been cleared of these viruses before being transfused to another patient. So those are the major risks I can say.
Wow. In case you're just joining us, this is You and Your Health on Clearview Television. And I've been here with Dr. Chikaodinaka Ezeokeke from Wuse District Hospital. And when we return, the program continues. Stay with us.
Night concert is the secret of cheap viewing. All you have to do, just get your decoder, any free-to-air decoder at all, and tell the installer to track it to Night concert.
So you get all your latest news from there.
It's only that, entertainment, Hausa programs, sports, even news from the villa, and plenty other things.
And I've been burning my money on that company from Southeast Africa or Northeast Africa or somewhere. I'll be back.
When are you going to?
To get my decoder, of course.
It's Switchover Time, Nigeria Communication Satellite, Nightcomsat. It is viewed in about 38 countries. No subscription. Just buy the free-to-air decoder. Be part of this, and you have access to Clearview Television 24 hours, 7 days.
And welcome back. This is You and Your Health on Clearview Television. And today we've been talking about hepatitis. And with me in the studio is Dr. Chikaodinaka Ezeokeke from Wuse District Hospital.
Yeah.
And she's been doing justice to it. At this point, Doctor, I would want to know, as a medical practitioner whose primary duty is to save lives in Nigeria, what approach do you think is most suitable, in identifying people with hepatitis?
Now, this question is very, very important. I've asked myself this question a lot of times because we only read these things in books, but we don't actually do them. And that's where there's a big problem. The best way to actually get patients with hepatitis early is actually by screening them early, finding them out early. And you can't do that when the people in the grassroots are still yet to, get quality health care. If you check the primary health care centers all around Abuja, for example, how many of them are functioning? And these are the centers that are supposed to actually be reaching out to the grassroots, through programs organized regularly. At this grassroots region. I work in Wuse. There's hardly any time for me to go to the interiors of Lugbe or these places because the patients in Wuse are just enough for me to handle. You understand? So there has to be a lot of programs, calling out patients, doing a lot of screening exercise to find these people out early so that they can be treated early. So early diagnosis has always been a great form of secondary prevention, early diagnosis. Because when patient is found early, you reduce the risk to every of the organs. So that's basically it. So I think we need to go to the grassroots. Let's look for these people. Let's go in. Let's go out. Let's go back to the basics. Let's start from there to develop campaigns, so that we can, the campaign, the public health system, let's call out people so they can be aware that there's something like hepatitis and it can be treated early to avoid problems in the future. So when primary healthcare system works in a country, you see that healthcare delivery is superb because you reach the unreached. Because for every local government or area council or every little ward, there is a primary health care center. And for example, I noticed there's where I stay in Dawaki. So there's a primary health care center in Dawaki. There's another one in Duse. Those centers are supposed to cover that area. Dawaki, which is just an area. Duse, which is just an area. So tell me if we have such in different areas in Abuja, and everybody that is sick first goes to that primary health care, gets some form of treatment. If the treatment ends there, fine, with the confidence. And then when the treatment goes beyond that, the primary health care system refers you to the general hospital. Then apart from that, they educate the people around. There won't be a problem. Imagine one primary health care center, Dawaki, one in the whole of Dawaki will have to be educated, whether they like it or not. So I think the government needs to do a lot when it comes to primary health care. Right.
Now we know the government needs to do a lot when it comes to primary health care, maybe like equipping it, getting the people trained and all of that.
To do the work.
No, that's for government. And I hope they hear and they step up, they come up to
Yeah.
help us.
Yeah.
And now, what role do you think an individual have
Basically.
to play, in this fight to stay healthy and, to ensure that your next neighbor does not contract this disease?
Yeah.
And then people who are already having it, how, they can handle it, how they can manage it and maybe get a permanent cure.
Okay. For individuals, basically, I always tell my patients that when you have a problem, health problem, and you come to the hospital, if you check the whole year, you don't come to hospital up to 5% of the whole year. Imagine a patient comes every 3 months to the hospital. Every 3 months, that's 4 times in a year. The rest of the days, who is with who? Is the doctor there? No. The patient is with his or herself. So what the patient knows actually goes a long way to curb an illness, to prevent an illness or that. So that's why, apart from giving the drugs and giving the treatment, what is most important is education. You have to educate the patient, because the reason why one person will tell another person that, no, this sickness, so okay, for example, in hepatitis, as we're talking about, in the acute one, there's sometimes abdominal swelling and all that. And they tell them, this one, now if you go native, they go mark you, like the thing will come down. You understand? It's because that person doesn't have education. If the patient is educated that is not the way to go, of course, you won't want to subject yourself to such treatment. You understand? Okay. So education of the patient actually makes the patient his or her own doctor before he actually comes to you. You understand? Because truth be told, the patient sees more of his or herself. He's with himself more than he's with you. No matter how much a patient sees a doctor, it's not more than 10% of the whole year. You understand? So we owe the patients to educate them regularly. When they have a problem, when they have something that you know that if you don't prevent, it will worsen, you take your time and counsel the patient. Now, your counseling the patient may not just be for that patient, because tomorrow that patient might see somebody else that's suffering from the same thing that he or she suffered, and he might want to provide a positive solution. So when you're educating somebody, you understand, it also reflects on those around him or her. And at the end of the day, we achieve a goal. That's why in many clinics, they have clubs for different illnesses. I know they have sickle cell clubs. Some people have diabetic club and all that. The essence of this is for education, for continuous education, because you just have to keep talking. You have to keep talking to them. You have to keep educating. And until you educate, until everybody gets a knowledge of this, we have to keep talking. We have to keep doing the campaigns on TV, on radio. Let them keep hearing it. There was a time when HIV was becoming very, very prevalent, and there was a lot of talk about it, radio, TV, even the children, even we as children then, we knew how to prevent the disease. So I think that should go on too for hepatitis.
All right.
Those campaigns, that's the goal.
All right, thank you very, very much. I must confess, I really enjoyed this session today.
Thank you so much.
And we've come to that point where we just have to say bye-bye to our viewers out there. And in case you just tune in, just know that we'll still come your way again. It's you and your health. Same time, same station next week. And remember to subscribe to our YouTube channel, Clearview TV. You can like us on Facebook, Clearview Television. Follow us on Twitter at Clearview Online. Follow us on Instagram at Clearview TV _NG. Till I come your way again, stay blessed, stay healthy. Bye-bye.